This segment of Delmarva Life is brought to you by TidalHealth.
We might be approaching the finish line for the month of February, but the health of your heart should remain a top priority all year long, not just during American Heart Month.
Yeah, and simple lifestyle changes can make all the difference in the world. So we'd like to introduce you to somebody this afternoon. This is Blair Jackson. Blair is a clinical exercise physiologist with TidalHealth Cardiovascular Pulmonary Rehabilitation and Preventative Cardiology. Get all that right?
You did.
Okay, all right. We were talking just a little bit before we got started here about some of the fun that you have doing what you do. It's important to take care of your heart. What is the TidalHealth team doing to educate the community about that?
So we actually offer what's called Heart Smart screenings. They basically bring you in, they look at your risk factors and the chance of you developing heart disease, and we educate you on lifestyle modifications, getting physically active, just to, again, educate the community on the risk factors and the symptoms associated with heart disease, heart attack, and even possibly stroke.
So let's talk about those risk factors. How would somebody know if they are at risk for heart disease?
So those risk factors, we look at whether you have high blood pressure, high cholesterol, if you're a diabetic, how physically active you are, if you're overweight. There's a lot of different things that kind of go in, especially even your family history, your age, gender's a big one as well. We encompass that and kind of look at everything as a whole and give it to you straight.
Yeah. Give it to you straight.
Yeah.
So there are symptoms to watch out for, and I guess they differ between men and women.
Correct. So typically you hear about people having heart attacks where they've got the crushing chest pain or pressure. It can radiate into your neck, jaw, down your arm, even between the shoulder blades. But women can sometimes present differently. They describe almost GI issues like indigestion or heartburn. They can just be short of breath and just really fatigued. So it's not really the telltale sign that you typically would think of as a heart attack.
Right, right. So what about people who have had a heart attack or are recovering from heart surgery? What does TidalHealth offer for them?
So we have actually it is the most comprehensive cardiovascular and pulmonary rehabilitation department in the Mid-Atlantic region. Since we've started in 1986, our patient contact volume is well over 1 million.
Wow.
So tell us a little bit more about the Heart Smart screening.
So we bring you in, we do a resting EKG. We also do your lipid profile, so we're looking at your cholesterol levels.
Okay.
We also look at your fasting blood sugar levels as well. We look at body composition, so that entails BMI, a waist and hip circumference, so we can kind of give you an idea of where you house the fat, because if you house it more in your midsection, you're more likely to develop heart disease. We also look at all your other vital signs, your resting heart rate, your oxygen saturation, telling me how well your tissues are getting oxygenated. So there's a wide variety of things we do in that screening to help you kind of understand where you stand at in regards to heart disease.
And you can help get our numbers where they need to be?
Right, so we also offer, once we kind of go through everything, we go through what each value means and what you could possibly do to improve that, whether that be becoming more active or even just seeing a cardiologist for medications, which are also another route that they use as well. So we really go in and look at your diet. Are you eating a heart-healthy diet? Moving enough? So it's a very comprehensive screening in a sense.
All right, we're down to the nitty-gritty. How do we make an appointment?
It's actually very easy. We offer appointments all the time. Usually we offer once a month, every Thursday. Obviously for Heart Month, we did it every Thursday, and we do multiple different locations. We've done Millsboro Primary Care, we've done the Mears campus in Seaford, we do Ocean Pines, as well as TidalHealth Peninsula Regional. All you have to do is call our department. I'm sure you guys have our number, 410-543-7026, and just tell them what you're calling for. The only thing that we ask of you is that you're not under the direct care of a cardiologist already, or you have known heart disease, and then they'll get you set up. We just ask for a 12-hour fast, so we have good results on the lipid profile.
Right.
But other than that, it's super simple and easy.
Easy as pie. TidalHealth clinical exercise physiologist Blair Jackson, thank you so much.
It's a pleasure being here.